Hello and welcome to a special Q&A with myself, James Maskell, and my partner, Gabe Hoffman. Welcome, Gabe. How you doing? Keeping hydrated over there?
Yes, James. Excited to be here and hydrated.
Good. Well, we are going to answer questions as long as we need to tonight. Gabe and I are really excited to bring the Practice Accelerator to you and share. We're going to go inside the Practice Accelerator tonight. So let's make sure that there are plenty of questions coming in. If you're listening to this, please put your questions here. Let us know where you're calling in from. I see Houston, Texas, Chicago, Illinois, Toronto, Ontario, Charlotte, North Carolina, California, Pittsburgh. Where else are people from? I do like Pittsburgh, actually. Gabe, let's see. Keep sending in where you are and your questions, and we'll get started there in a minute. I guess the first thing that Gabe and I wanted to do was to share a little bit about the Practice Accelerator. I think up until now, over the last 2 weeks with the book and the case series and the calculator and the webinars we did this weekend, our goal for all of this has been to just let you know, look, it's not a secret how to build an effective practice. And what we want to do today is to show you how the accelerator can accelerate your journey to practice success. So anything you want to add to that, Gabe?
Yeah, I mean, look, we've been passionately building this community for like the last 3 years, and our focus, and I know a lot of people there are people who've been following us all along and following you, James, and then there are people who this is all new, and there's been a lot to digest in the last week. So just to bring you quickly up to speed, I mean, we basically have been building this community, and our passion is to change medicine by empowering the doctors and the practitioners who are delivering this type of medicine, this type of healthcare, functional, integrative. And what we saw is it's a very inefficient process, and it's very challenging, and no one shows you how to do it. So we've been teaching these strategies for years on the Functional Forum, on the podcast, and recommending resources. And we want you to understand how the Practice Accelerator actually came together, because it was a byproduct of what we learned from the community as we've been going through this process of really just seeing how we can change medicine, how we can empower everyone.
Absolutely. So let's go inside the Practice Accelerator. We're going to take 5 or 10 minutes here just to show you what it is, so everyone's on the same page, and then we're going to take as many questions as possible. So if you have questions about your unique practice, put it into the practice chat box, and Gabe and I will go through it. That's the point of today. We really want to make time to work with our whole community and answer questions directly. All right, so here we go. So, the biggest elephant in the room is that practitioners have already invested heavily into creating meaningful and impactful practices. We know that whether you're either a health coach or a physician or anywhere in between, there is a significant investment of your time, effort, and particularly money to have a chance at impacting the health of many people. That is something that people are already doing and have already done. And what we're trying to do is to make it from here, a good investment. So you probably spent $210,000 on medical education. You've got continuing education. You go to conferences, you stay in hotels, you fly across the country. Maybe you've considered bringing in a marketing consultant in your practice who's going to charge $10,000 to $25,000. We know that practitioners have spent a lot of money on building a successful clinical career. And so, it's a huge part of what we see has already happened. And so carry on.
Well, I was just going to say, and the other elephant in the room for us has been, even though we've been teaching these same strategies and concepts for the last 3 years, we saw not enough change was happening. So we asked the community, why is there a gap? We know this information works. We see people with models that work. We're providing it. And it was really about implementation. The biggest challenge was, how do we actually implement these changes? And there was clearly a different level of support needed to make that happen.
Exactly. And who's going to pay for that support? That's the question, right? So, there are practice management programs out there that are $100,000, and you'll get with your coach every week, and they will back you up and to call you every week and make sure you're doing what you can see. Now, that might be a practitioners using those kind of services that are thriving. However, that's not really a fit for everyone. So what did we see? We saw that, that there was a real power in community. In the practices, what we were teaching was there was practices that if they were able to harness the power of peer-to-peer community support, were able to add way more value with way less money. That's the equation that we're looking to do. If we're looking at value-based care in the future of medicine and how to deliver value-based care, if you can deliver better outcomes at lower cost, you're in a great spot. And so we thought, what can we do we already have this huge community through the Functional Forum, arguably the biggest community on the planet of practitioners. So we decided to create a course that would deliver the information that we wanted to deliver in a scalable way, like you're watching right now, but it's the community that would support each other to implement it. If we could get a great community of people really passionate about implementation, put them in a group together and have them support each other, that was a way that we could deliver the value of what we wanted to do at a cost that was available to everyone. And there is such a mirror here between what we're doing for you guys and what you guys are doing for the patient, and that's part of the point too. We want to be able to, all the way through, and Gabe could talk to this more effectively, just like in the new model of medicine, you tell the patient, what to do, and then it's up to them to implement it. We tell you what to do, but it's up to you to implement it. And that's why we created the Practice Accelerator. So just a little bit about the Accelerator. So it's an online training program and community. It gives you a step-by-step guide to create the perfect micro practice that's right for you. And the three main areas that we're going to focus on, the big overarching theme is practice efficiency, because functional medicine is not efficient enough to be able to serve the masses. It's too time intensive, and we need to focus on ways to become efficient. We're going to look at efficient ways to deliver patient education, because one-to-one, face-to-face, the way that it's always been done, is not the most efficient system for today's times. And then the third thing is practice marketing. How can you do what actually works in the new era where not everyone's listening to the radio, not everyone's watching TV, social media is moving fast, but there are new assets and new tools that you can use to become super relevant to the people within 10 miles of your practice. And that's the other thing we saw. Everything else out there was basically turning you into a celebrity, which is fine, but we can't build a whole medical system based on many, many health celebrities. It's just not going to work. And that's why we built the Accelerator. So I hope that sets it up clearly.
Yeah, and so when we talk about the whole focus of the Accelerator, is not to teach the same information we've been teaching. It's to actually help you implement it. So we've put together step-by-step instructional guides with videos and copy written for you. The whole idea is implementation. We realize that it's not about you guys need to, there is information you need to know, but a lot of that is there. It's out there. What has to happen is, and what we learned from the community is more support with step-by-step guides to take us through it. And the reason why, you see here, we built it based on the feedback from the community of practitioners, and we built it with 200 practitioners through pilots over the summer. Basically, what we figured out is just that to make it affordable, we didn't want to provide one-on-one coaching. We wanted to leverage the power of community, but combine that with step-by-step instructions. And we feel like by doing that, the implementation has gotten so much better. And from the people we've worked with to build this, the 200 practitioners, the implementation has been so much better. So that's why we've been so excited about it, and really wanted to get a chance, and excited tonight to show you exactly what this course is, because there's some really unique aspects to it. And it's really because we built it with you, instead of, we didn't build the course and then find you guys. We've already been working with you guys, and now we're building the course.
Absolutely. So let's talk about, we use the word micro practice a lot, and I just want to talk about that because I hope this is not off-putting, right? The modern micro practice is a term that we came up with because what we saw was, this is the gap. Gabe mentioned the gap earlier. there's a gap between where people assume that they need to build the practice they assume they need to build, and where they are now. And there's a huge gap. And what fills that gap is this micro practice. It's low overhead. It uses technology to enhance patient education and communication, and it's community building instead of marketing. Starting to build a community around your practice, which means you're meeting new people and you're introducing them to each other. So Gabe, as we're talking about this, what are some of your thoughts about the low overhead micro practice?
Yeah, so the important thing we want to get across too is that the modern micro practice is not about having a tiny practice. It's about understanding that this is a foundation that you can scale into any size you want. So the micro practice is what sits as your foundation to then create a big center or a small center or a really unique, something that fits your lifestyle. But the idea is it's low overhead, it's lean, and you can scale from there. You have automation built in, and you're really, so just the word micro can be confusing for some people, but what we want to really make sure to understand is we have people working with us who have huge practices that are incorporating this into it to build a new foundation and transition. And then we have people starting from scratch. So it doesn't really matter where you are. The concepts of the micro practice and the sort of the foundational aspects, which is efficiency, patient education, and the way that the marketing is taught, which is also involving community, are things that can be applied no matter what kind of practice you have or what kind of practitioner you are. So
absolutely.
Yeah.
So so that's a huge piece there. So what the accelerator actually is, we got 4 training modules, which is our multi-videos. We got dozens of step-by-step video tutorials. We got ready-to-use email and script templates. We've got a curated library of resources. We got access to legal, health coaching, and practice development experts. And more than anything is the peer-to-peer support of other practitioners just like you who are making this happen all over the world. And that's the that's the focus of the accelerator. So just to give you a little bit of the idea of each of these different modules, in the first module, we're going to talk about the foundation of your micro practice. You're going to learn about the options. You're going to go through this lean canvas business planning, which is awesome. Tom Blue introduced us to this. And in about 45 minutes, you can put together a business plan, but that's super valuable and will guide you to make all your decisions for the rest of it. You're going to customize your email sequence, and you're going to actually deploy your autoresponder. One of the things that we really learned from doing 2 pilots this summer was that we realized that if you could get people to deploy their email autoresponder within the first couple days of taking the course, then they would get so much momentum and feel that, just like your patient that's able to get better sleep or better energy within a couple days of starting your protocol. It gives them momentum to do everything else. Gabe, what are your thoughts on that?
Yeah, I mean, look, after the first module, you will already have addressed marketing, patient education, and practice efficiency, because we sort of, the combination of the autoresponder and the business plan give you the foundation for all these areas, and then the rest of the modules help you add to that. So and again, this is a course you can take at your own pace. There's no, this is not a sprint. This is all about implementation, and whatever you have to do, you just take it one step at a time, but you implement and you communicate with the community and let them know where you're at. And just the first module alone will make an enormous difference for a practice once it's implemented.
Right, we've already had a question here, Anon8919. What does access to coaches mean? Thanks. So we're not giving you access to your own personal coach. Look, if you want your own personal coach, go and get one. You can pay for that and you can organize it. We're not in that business. What that means is that we have so many practitioners that we're recommending to hire a health coach into their practice or hire another provider like that. And so what we have inside the accelerator is that we interviewed practitioners who have built that model and asked them, how do you find these health coaches? How do you train these health coaches? How do you, how do you pay these health coaches? How do you organize your practice in a way to work together? So that's really, to answer your question, it's all about, like, if you're looking to bring health coach into the practice, it's about the practicalities of doing that. How do you pay that? How to organize? And just in the Facebook group today, we were talking about the fact that, some health coaches think they need to be paid $150 an hour, or that's what they assume that they can make. And, people were a bit concerned about that, and they were thinking maybe less. And I was just giving the example of, of massage therapy, where if you're a massage therapist and you're really, and you build a business around it, you can charge $80, $100, $150, $200 an hour. My mother-in-law's a massage therapist and charges her $200 an hour because she's been doing this for 30 years and her clients love her. But if you go to work for Massage Envy, you don't get $200 an hour. In fact, you get like $20 an hour or $15 an hour, because now you're just a manual worker. You're not an entrepreneur. And so that's, these are the kind of things that you can save yourself a ton of time and wasted options to be able to to make this process more user friendly, and to not make the mistakes that anyone else in the community has already made. So, one other question. Thanks, Bob. I see it's $3,000. Do I have that right? What are the payment options? You can pay one payment up front, or you can pay 7 payments of $497. You will save $482 if you pay up front, but you can make the 7 pay option. And just to be really clear with everyone, if you show up and if you start implementing it, get into it straight away. And if you feel like this is not something that you could implement, or, within 30 days, let us know. We have a very flexible refund policy. We don't want to trap anyone in a course. We want to empower the micro practice revolution, for God's sake. We want everyone to be successful in building a practice. What we've done on the accelerator is bring together all the best practices to make it easy for you. So, Bob, I hope that answers your question.
Let's get through these slides, and then we can just go full on Q&A, because there are probably some things that'll get answered as we go through.
Okay, so the second module is practice efficiency. Leveraging, we're going to talk about provider teams is one of the key ways to make efficiency. Leveraging group structures is a great way to create efficiencies, and the use of technologies. Supplement management, telemedicine, EMRs, technologies for patient acquisition, intake, scheduling, tracking, communication. These are the kind of tools that, that practitioners are using to create more efficient practices. And so,
and also just understanding that efficiency is what we teach before marketing, because if you're bringing people into an inefficient practice, the marketing will never be what it can be. And the whole idea is we believe and we know that for this health movement to happen, doctors and practitioners have to be successful, not just financially, but in terms of their time and lifestyle, because you're teaching people to take care of themselves. And in the last year, I've spoke to about 1,500 practitioners about their practice and talked to them and help guide them to different technologies and different strategies. And basically, at best, the most successful integrative practitioner is totally overwhelmed because they're not building it in a scalable way. So efficiency is so important, because once you're efficient, then you bring people in and you're actually growing without it just being coming out of your time. What we want to see is people's time get freed up.
Absolutely. I see lots of awesome questions that we're going to be able to address. So keep the questions coming in, and we'll go through the rest of these slides here. So the third module is patient education. So obviously, patient education is a huge part of medicine that is participatory. We're going to go through the 7 different forms of patient education, and we're really going to help you improve your autoresponder that you set up in module 1 to do pre-appointment education, post-appointment education. A lot of the practices we're working with will have particular trainings or combinations of like packages for type 2 diabetes reversal or digestive disorders, and you can create custom education sequences for that, and how to create create remarkable in-person experiences that are easy to set up, and things like community events, and then also an optimal system from web to front desk. So like if you have a website and it's pushing everyone to the front desk, and your front desk person isn't good at turning those people into patients, that is something that we can address too. So patient education is typically the biggest time suck for people who are delivering functional integrated medicine, because you need to educate your patients, but you don't need to educate your patients one-on-one directly. You can do it through more scaled means with the use of technology.
Look, and what we know is that the truth of this type of medicine is it's all about patient education, because it's about empowering the patient to take care of themselves. And if the way this model is going to be set up is doctors one at a time sitting with patients teaching them this, we will never be able to take care of enough people and help enough people. So understanding how to leverage and scale patient education is at the core of transforming healthcare on this planet. I fully believe that.
Awesome. So the fourth module is all about practice marketing. So again, with your lean canvas approach, in 40 minutes, you'll have a real idea of who your target market is, where they are, and how you're going to find them. We're going to optimize your conversion engine. So conversion engines are events and things that you would do to be able to bring patients, turn interest into new patients. We're going to teach you how to activate patient referrals from other synergistic practitioners. We're going to work out which traffic source is right for you, how to use free traffic source, paid traffic sources, step by step on how to set up Facebook ads to push to a local event, and those kind of tools. So that's what you want by the end of it is a tap where you can turn on new patients and get new patients, and turn it off if you can't take new patients. As you improve, you're going to see that improving efficiency and improving new patients is going to be a bit of a dance back and forth as you build that. So look, the big investment in the room. Practitioners have already invested heavily in creating impactful practices. We know that you spent a lot of it. You can join today for $497. Start taking the course. You got 30 days to get your money back. If you don't like it, or you don't think it's valuable, or you're not capable of implementing it, and you need another, we can make recommendations of companies that have much more coaching for you. It's going to cost a hell of a lot more, but these are the choices that are available to you. We've looked to take advantage of the community aspect of what we provide to go from there. Gabe, there are so many questions. Where should we go from here?
Yeah, I mean, well,
we mentioned the satisfaction guarantee, within 30 days, we want to be as loose as possible with people on this. What we really want is practice success. And if you're being successful with our program, you'll keep it. If you're not being successful with our program, you can return it. More than anything, we just want you to be successful with some program. Just build a successful practice. And if our system isn't right for you, find a system that is. If you're the kind of patient that needs a health coach or someone to call you up every day and remind you to do stuff, I'm not sure if that's us, but we do have a community to support and empower each other.
We do have and you have some testimonials in the deck too. Like we basically, you'll see the Facebook group, you see there's doctors we've gone through it with, and ultimately we just saw that if things don't get implemented, this isn't going to happen. So how can you actually make these changes? No one's going to teach you, no one has been teaching them. So, you'll see some of these, despite years of training, they were still afraid to take the leap. They heard about the accelerator course, took a leap of faith and joined. It's taken the vision of the practice out of their head, translated it into a practical, implementable model. And ultimately, this is really exactly what we wanted to see happen, is that people felt it was practical and could be implemented. And that's the feedback we got. And just realize we built this program with these practitioners. There were 200 people in the pilot, and we've been learning from and studying practitioners for the last 3 years intimately and longer. James has been teaching this. So, that's how the information came together. And rather than just be a coaching company, which is very powerful, but also not everyone can afford it, we tried to put this together in a way that would give the step-by-step instructions and was affordable for people, but we could also deliver what we said we were going to deliver. So we were able to make it this way and use the Facebook, and we see the testimonials here.
Okay, so look, I want to get onto the questions because I know we'll be talking a lot about the course. And there's tons of questions in here. All right, so look, there are a few questions coming in about like, who are you guys? What are your qualifications to give advice on building a functional medicine practice? So listen, we've built the biggest community of functional medicine practitioners. I've been speaking at conferences since 2011. My talks have been now with IFM, A4M. All of the organizations have got me on stage because I've done this. I've worked with thousands of practitioners from 2005 to 2007. I ran a MediSpa. From 2007 to 2013, I helped all kinds of practitioners all over the Northeast build successful practices. You say here, our practice secures 35 to 40 new patients a month with almost no advertising. Can you help us improve? That's amazing. Look, if you've got 35 to 40 new patients, I don't know what kind of practice you have, but like, it sounds like getting new patients in isn't the problem. What we see with most practitioners is that, they're good at marketing, or with some practitioners, they get the patients in, but then the actual care is way too inefficient and they end up running out of time. And so a big combination, a big organization, the majority of practitioners that we see really need help with the practice efficiency because the care that they're delivering is not efficient enough, and they're able to only see few people per day and not able to, to be able to have the kind of local practice impact that they want. So, Gabe, my partner, you can speak to your conference, but we ran some centers in New York for a number of years in a cash model. And, we've built this big community pretty much based on our ability. And not to put too fine a point on it, but I wrote the book too. 50,000 downloads 2 weeks ago. Doctors switching to functional medicine as a result of reading the book. I hope that is qualification.
It's a fair question. You guys have been out in the field working, making these things happen for years. What we see and what we've been doing is building a community to help take this movement to the next level and to help integrate and implement the newest technologies and strategies that we've seen. Measuring success for us and for the people in this community. And I spent 10 years as a practitioner, and then, now we've been passionate about this side because I felt like, and James and I felt like we could do more for this movement by empowering the doctors and the practitioners than me working with people one at a time. And so the functional forum, if you're not aware, we didn't really get into it in the beginning, but basically we have the show, the functional forum. It's the first Monday of every month. And that's where we talk about all of these ways of leveraging your time. We've met some of the most successful practitioners in the country that aren't just successful financially and with patients, but also are creating lifestyles that work for them, that allow them to have free time, that allow them to spend time with their family, and that allow them to take care of people, not just the wealthiest of us, but the middle-class person that needs help, that needs to have access to this type of information. If you're in a fee-for-service model, it is very, very hard to pay your bills and help the middle-class person if you're in a fee-for-service model and you're spending an hour to an hour and a half with each patient. So our passion has been to empower and take take this movement to the next level by creating a more efficient practice, and that's really what's in the accelerator. And that's the information we've been showing on the forum.
Absolutely.
James, maybe go to a slide that could just show people how the pricing works again, just because we kind of scanned through it, and That's probably one of the main questions.
Look, there are other questions here I want to get into. So a practitioner asks, I have a direct primary care practice in Georgia. Let me just find this here. Southern Care Direct, Georgia, a traditional DPC practice. Look, for a traditional DPC practice, here's the run of the mill. I certainly feel that direct primary care is a really strong business model. The thing about direct primary care, it's a great business model. You reduce your patient numbers, you get out of the system, you can still offer care at a low price, and you can still work with the middle of the bell curve. The thing about it is, the thing about direct primary care is that if you're just doing the same medicine but slower, then does it actually lead to better health outcomes? And what we've seen is that there's a real synergy between direct primary care, the business model, which gives you time to practice. And if you watched our webinar this last weekend, one of the major strategies for health transformation is to be able to get time with patients, but you need to be able to use that time to actually create health. And that's why we think functional medicine as the clinical operating system and DPC, direct primary care, as a practice system is a good system. And what you're going to learn in the accelerator is how to educate patients effectively without taking up too much of your time. All the things that take a lot of time in functional medicine, the intake, the supplements, the labs, the patient tracking, the communication. There are technologies that are being built that for the first time in history are effective enough to help you run this low overhead practice. And so that's what we're really focused on in the accelerator. So Hans is asking about supplements. One of my big problems is following up with patients that need supplements over months. And Hans says, please expand upon supplement management. So look, one of the things that we've seen is that, supplements is a very interesting world. And this was my world for 7 years. And I would say that, in the first era of functional medicine, everyone just had to do supplements, right? Because they realized that they were valuable. They felt a moral obligation to practice this type of medicine, and they just had to make it work. So these supplement companies emerged that only sent the doctors, and the only real model was to get all the supplements in your practice and sell them out of your practice. Now, at this moment in history, now we have the next generation of technology where you don't necessarily have to have all of the supplements on hand for your patient straight away, because you could basically use technologies that are online. We recommend FullScript, and that's not a secret. They've been one of our sponsors all the way through the Functional Forum. Go to goevomed.com/FullScript. And if you go to FullScript and you set up an account, you have access to 200 professional brands, 275 professional brands, 20,000 SKUs, and you can make prescriptions of supplements to your patients, and then your patients can refill directly. And what we found, to answer your second question, is that if you do it this way, it's less likely that it's more likely the patients are going to continue to take your recommendations. It's less likely they're going to fall off in months 2 and 3 where the rubber really hits the road, where they need to be able to continue these good behaviors. So, the other thing that we've seen is that a lot of functional practices will stock up on all the supplements at the beginning, and that's a lot of capital tied up, which could be used for patient acquisition. 75% of functional medicine practitioners, and this came out in the Institute for Functional Medicine survey, have a budget for new patients that's under $250 a month. That is not really a marketing budget in my mind. And what we teach in the accelerator is how to have a predictable system, so that if you spend $4,000 on Facebook ads, you'll get 100 people in a room and who are all live in 10 miles and are all within 10 miles of your practice and are all, ready to get healthy. And then you have to close a certain percentage of those patients, and you can see the return on investment on your initial investment. And that's the kind of system that you need in order to continue to bring in new patients. And you may not have to run that forever, because then you'll start getting referrals. If you're creating a remarkable practice experience, then you'll be in great shape to be able to get referrals from them, make it easy for patients to refer, and go from there.
James, maybe go to this slide that shows the inside of the course again, just so people can see what it looks like. Yeah, and having the over here. Yeah, so you could see in this picture, like there's little check boxes. So you'll have videos where we teach things, but beneath that is all the resources, and the resources are really why the difference between you could access any of our shows, any of the episodes we have for the last 3 years. There's 30 episodes of the Functional Forum. There's been a podcast every week. What's different here is the implementation is more supported, because we're giving you ready to use email and script templates, curated library of resources. We have within the community health coaching experts, legal help, peer-to-peer support, dozens of step-by-step videos. So it's all about implementation. These ideas have been there, and we just see that the community struggled with how to implement them. So here's a question: do we help with integration of different modalities, chiropractic, functional medicine, and massage therapy. So again, up until now, like, you could never hire us as a consulting company. We could recommend other things. We've created this course because it's the first time we have something that we can actually share with the community. So do we help with the integration of it? I would say that the integration of those modalities depends on your ability to create some kind of micro practice. You've got to understand how to create the right type of communication within the practice, the right type of patient education strategies, the right type of marketing, and who on this team that you have is going to play what role. So yes, this information will help you understand how to channel it. Also, your ability, and maybe go to the Facebook slide, your ability to communicate with the community through the Facebook group is invaluable when it comes to that, because everyone has different types of practices. So you post a question about that, and you guys and everyone talks to each other about what's working, what's not working, how are you setting it up. So yes, the course helps with the integration of those modalities. No, you're not on the phone with us to coach you through that, but you have the information, and we're happy to, in the group coaching calls, we definitely could answer it more specifically. We'd have to know more about your practice, but in general, the better resource for you is the Facebook group and how that supports those types of questions, because every practice is a little bit different, but ultimately understanding how to leverage your time, how to make it more efficient, how to incorporate technology, and how to scale has to be at the foundation of all of these practices moving forward, for us to be able to help the people that need it, and for you guys to free up your time so you can spend more time with your family and be in more control of your schedule.
And so there's a few questions here. Thanks for the questions, keep coming in. Versus cash versus insurance. So look, there are insurance things emerging. So we're in a world right now where things are about to move in the next 4 years to value-based payments. So there is going to be, over time, more and more reason for practitioners to be able to take insurance where you're going to get value-based payments. At this very moment where you're doing insurance with fee-for-service, it is very, very difficult to build a successful functional medicine practice doing insurance. There are examples. We've done 108 episodes of our podcast, and we've interviewed doctors that have done it successfully on insurance. Typically, you have to be pretty creative with the CPT codes, and you have to be able to, to work out how to get paid for your time. It's not impossible, but it's definitely not easy. What we recommend is,
I want to mention too that you'll see, guys, in the chat here, there's a link to goevomed.com/accelerator. Like, I know, the link that we flashed on the screen was /join. That's where you actually join. But if you go to /accelerator, you'll see it's a whole page with tons of, not tons, but a description of the course in more detail, as well as the testimonials and some of the things that we sort of moved through quickly. We moved quickly because we wanted to be able to get to everyone's questions. And at the same time, this is something that you have to think about if this is a fit for you or not. But what we've seen and why we created it the way we did, where you can move at your own pace, you have access to the course forever. We're constantly updating it and upgrading it. You have access to all those upgrades that we make. The Facebook group will function forever. So it's not something like you're in a course for a couple of weeks and then you have to finish it. It's not a race. This is just about how can you implement things to change your practice and change your life. And the one thing you implement this month will be affecting your practice forever. So you can learn more about that by going to goevomed.com/accelerator. People post needs to us in the Facebook group, and we have made resources for them based on what they ask for. So the idea is that it's an evolving living organism. This is not we built a course, there's one way to do it, here's what you need to do. We understand where people have to get to. We understand it because we have built the biggest community of you guys and women and men. We built the biggest community of practitioners, and we've spoken to you and we've learned from you, and we've spoken to the most successful ones, and we've spoken to the majority which are struggling. And as a result, we know where it needs to go. but how you get there has to do with implementation, and what you need to be able to implement can vary. So we develop new resources all the time, and constantly changing them and updating them and adding as much as we can to just satisfy who's within the group. And we're all learning. Like, this community you guys are the pioneers. You know, if this was already created, if everyone knew exactly what to do, it would be done, right? So we're making this happen together, and there is a lot that can already be implemented. There are people doing it successfully, and we are extremely excited to give you access to whatever we've learned and whatever we will continue to learn as we continue to grow this community.
Awesome. So we've had the question here, is it helpful to a midwife, women's health nurse practitioner thinking about starting their own practice? And yeah, absolutely. That's exactly who we started this for. You got to start on the right realm. The micro practice is the thing. You've got to build the low overhead practice before you build the much bigger practice, and getting the technologies and systems in place gives you the right blueprint with how to scale. If you don't do this like this at the beginning, even if you're ridiculously successful and you bring in tons of patients, you're going to run out of time very, very quickly. That's a common thing that so many of our practitioners have told us. Gabe spoke to 1,000 practitioners over the last year and a half through our concierge program, and that is the number one thing that comes up, is people run out of time. So if you're going to start your own practice, if you're a nurse practitioner, hell yeah, you need to start your own practice. You need to, there's so much need for what you need. There's so much value in building a successful practice like that. People need this kind of care, especially the midwifery and the early stage care. And so, we will give you a blueprint to start your own practice, and you can start building it before you quit your job, so that you can have a safe place to go. You can titrate across from your current job, so that you can get to a point where you can jump fully into your practice once you've built enough of a solid foundation that you're ready to go. And dozens of practitioners have done that through the first 2 iterations of our Practice Accelerator this summer. Just to go back to the cash versus insurance, we do talk a little bit about things like Dean Ornish's model, where you can get paid $7,200 to do, his intense cardiac rehab. It's available on Medicare and Medicaid. The thing about it is you need a massive panel of cardiology patients. You need massive heart attack panels. And so it's really only good for massive groups of cardiologists. But what we are looking for is to inspire the next Ornishes to create these things for psychiatry and other, specialists where it's obvious that lifestyle component is an area, is a concern. So, we have the most innovative practitioners in the community, in our community, and that's a big thing. Just to come back to the credibility, our course is the first ever practice management course that's been endorsed by the Institute for Functional Medicine. And that's kind of a big deal, because there are other companies and other education organizations out there where you could become the official blank of that organization, but you would be paying for that. That's not the Institute for Functional Medicine. We earned this from having practitioners go through it. They vetted it. They've seen 200 practitioners go through it and have great success. They've seen the testimonials that 2 of their doctors went through the course themselves. So, by them putting their stamp of approval on it, we hope that it's enough for any practitioner to say, look, I really want to get there. This is where I want to get to with my practice. I'll give it a go and see how it goes. And we'd love to have you.
And the reason the reason we've been successful with it is not a secret either. It's because we didn't build it by ourselves in a bubble. We built it with actually the people in the field executing this and making these changes. And we did it as a family, really. And that's sort of what you're being invited into when we're opening this course up now to the public, is just being part of this community that's developing and working together to change healthcare. I think, James, maybe go to another testimonial slide.
Okay. So this is David Gordon, who's is Dr. David Gordon, and he says, shout out to James Maskell Gabe Hoffman and the whole EvoMed team. Today I mailed letters to all current patients about my January 1 shift to a membership-based functional medicine practice. They'll start receiving an informational autoresponder Saturday. You remember that? The autoresponder is one of the key things that we do. It's one of the most significant days in my professional career, and finding the Functional Forum last December has really made this process doable. Thanks to all the Accelerator participants as well. The community and support here has been nothing short of phenomenal. Finally, the last speech by Dr. Feldman at Monday's FF, which was the September Functional Forum, was perfect timing to remind me of why I'm disrupting what was a pretty stable and predictable professional situation. Proud to be making the change and on the forefront of the future of healthcare. So it's pretty exciting to hear that from doctors and see that doctors are not only being inspired to take action, but then are actually doing it. Okay, question here. I'm a manual osteopath and TCM practitioner in Nova Scotia, Canada. I have a website, an online booking system, and I'm trying to build my practice. How can this help me? Okay, great question. So listen, and there's another question I want to get to here. So look, a website and online booking system is a great starting point. You need to have a booking system where people can book all the time. The key thing is, how many people are you getting into that booking system? And when they get to that booking system and they book an appointment, how are you developing their patient experience that's efficient enough so that you don't have to take up all their time? So when does the patient education process start? When they're sitting face-to-face with you in the practice, or are they getting a sequence of educational experiences before they come to your appointment and after that first appointment that's delivered completely scalably without any of your time and makes it easy for them to really understand their role in participating in their own care? That's an important part of patient education. Once they come in for an appointment, is it an hour and a half intake? Are you having to do all of the intake manually on a piece of paper because you don't have the right intake technology tools to be able to do the intake in a way that doesn't take up your time and allows you to spend the time with them to really find out, who is this person? What do they want their health to look like in 2 years, and how are they going to get there? Those are the kind of questions that, that really engage patients to want to be participatory in their care. And if you're spending all of your time just telling them stuff, it doesn't really give you the time to be able to really, to be able to really engage with it. So to answer your question, it's getting more people into the booking system, getting more people to your website, getting more people to your events in the community that help turn interested people into patients. It's then educating them efficiently so that they're getting educated not on your time, and that you can use the time that you spend with them creating a really remarkable experience so they tell all their friends and they're able to get well as quickly as possible. Gabe?
And yeah, it's also just evaluating, what you're doing is great, and I've spoken to so many practitioners and they don't all have that set up. But ultimately, it's what happens once they come in. It's good to have that online scheduling and to have a website, but once you're seeing patients, that's what we're learning is, where does your time go? How many patients can you see? Can you continue to bring people in, or at some point are you another doctor with a waiting list who's essentially self-employed? The whole thing is, we have to learn to work at scale, teach people in groups, not spend your time repeating yourself throughout the day. Pre-educating people so that before they come and sit down with you, they have an understanding of who you are, what's important to you. You've already given them value and given them some ideas on what could change their life and some changes they can make that would help them. So many great clinicians in this field that I speak to every day with huge hearts and very little time and very precious time, and have their own families. And it's like, ultimately they're seeing 8 people a day and going over a lot of similar foundational information, not realizing that they don't actually have to sit there and do it. So, the online booking system and the website is great, but just having patients come into your office is not enough. It's where are they going from there? What's the experience, and where do you want to see your lifestyle be? What kind of lifestyle do you want to have? If you look at, if you read James's book, or you look at the case study we did with Dr. Jeffrey Glad, he's working. I mean, James, maybe share a little bit about Dr. Glad's practice and sort of what that looks like.
Yeah, so
I think that's really important for you guys to understand sort of what the goal is of where we're looking to help take practices and where we are taking practices and the practices that we've seen and who we want to emulate.
Yeah, Dr. Glad's clinic now is in Fort Wayne, Indiana. So definitely, a very, anywhere USA place. It's not in a big, in a big city, but he's got, one doctor, 2 nurse practitioners, nutritionist, and health coach. And, they're seeing 25 to 30 new patients a week, but he works 2.5 days a week, and he picks up his kid from school every afternoon, and he can take 3 weeks off in the summer. And he's chosen to have that kind of work-life balance. Other people, when they build a successful micro practice, they want to go and do other, bigger things with their time. But what they do get back is their time, so they can really, to do as much as possible there. So, and that's Dr. Glad, who's come from being a primary care doctor who was sick and tired, got himself well, tried to do this in a hospital environment, didn't have the right model for that, got closed down, and realized that the micro practice was the solution. And in all of these cases, the gap between where you are now and where you want to be is typically the micro practice, because it's well organized, it's well oiled, it's technologically advanced, and it allows you to reduce the overhead so that you can learn the skills. There's a question here: why do you state you need 12 patients per day for financial viability? So here's the point on that, because that's a really, really, really good question. So in the recent Institute for Functional Medicine data set, what they saw is that the average functional medicine doctor is seeing 7.4 patients per day, and the average physician is seeing 19 patients per day in America. So it's about a 3-to-1 ratio. It's about a third as efficient. And so the reason why we say 12 patients a day is that on the average, if you look at how much money doctors are making, the sad fact is, at this moment, the average functional medicine doctor is making less than the doctor. But they're not making a third of the amount. They're making, I think it was like $200,000 to $150,000 or something like that. So the reason why we say 12 patients, now this isn't going to be the same for everyone. If you're doing a chiropractic model with functional medicine, you may be seeing people more quickly. If you're doing acupuncture, you can have 7 people in a different room, and so that there are different models there. But the reason why we say 12 is that if you can go from 7.4 to 12 per day, then you are going to be making, because functional medicine monetizes each patient better than regular medicine, at that moment, if the average goes up to 12, what we'll start to see is that functional medicine doctors will make more money than primary care and family medicine doctors. And that's what needs to happen to send the right signals into the market for this revolution. The revolution, healthcare. There are a lot of doctors. The first doctors that came across to functional medicine are only ones that felt a moral obligation to practice this type of medicine. What we need to happen is that functional medicine needs to be more monetarily effective so that the right signals go into the market. So every primary care, family medicine, internal medicine doctor goes, wow, that doctor down the road has an endless stream of patients, is very happy with his life, is making lots of money. I should do that. That's what we think is going to be the evolution of medicine. Medicine adapting to its new environment of chronic disease and solving chronic disease in the most efficient way. It's not going to happen through big organizations. They take a lot of time to change. It's going to happen through entrepreneurship, because it can happen really quickly. And so we think that if we can get the average functional medicine practice to 12 patients a day with the same fee structure and with more efficiency, we can help functional medicine doctors, all of them, make more money. At the moment, the only functional doctors that make more money than their regular doctor colleagues are the ones, and this was proven from that thing too, the ones that are early adopters of technology, the one that feel comfortable charging their patients for money. It's all in that. All of the ideas that we came up with is from spending 3 years building this community, speaking to tens of thousands of practitioners over the last decade, and then this survey that came out in March that showed that that brought out exactly what we'd been thinking for the last 10 years and teaching or otherwise, that efficiency was a problem. And just to give you one example, Living Matrix, if you use that technology and you use that for your intake form, that takes you from 7.4 to 8.7. You add 1.3 patients per day just for using one technology. So imagine now if you're starting to use patient education, you're starting to use other technologies. Imagine if you're doing a group visit twice a week, a group visit with 16 patients paying you $10, $20 cash coming in. That increases the number of people coming through your practice, and you can get to 12 very quickly. So that's the reason why we say 12. It's going to be different for different people in different ways, but on the average, if we can go from 7.4 to 12, that's a 53% increase in efficiency. And if you can see that many more people, and the dollars are going to go up proportionally, the number of supplements you sell are going to go up proportionally, the number of labs you're going to do will go up proportionally. What you're going to see is you're going to see that most functional doctors are going to make more money than primary care, family medicine, and internal medicine colleagues, and you will see the rush to practice this type of medicine, and medicine will shift, and that's what we're trying to empower right now.
Absolutely. And here's a great question. So is the education done for you? Is I don't have time to copyright email campaigns, content, all the time involved for that. Will this program meet these needs? So there's a couple things I want to say here. Number one, yes, we've written a lot of the copy for you. And that's part of that. That's part of why this course is the way it is. We do a lot of the copy. Number two, there's certain things like no one can write all your copy for you because of the fact that everyone practices medicine differently and has different belief systems around it. One of the things we've seen is that in the Facebook group, different practitioners will actually collaborate with each other and help share the load, because it does take effort to create copy. The other thing I'll say is the idea, the fact that you don't have time to copyright and email campaigns and content is part of the reason why this course is there. It's like there's a Zen story that's basically like this person, he tells the person goes to the guru and he's like, you need to meditate for 30 minutes. And the person says, I don't have 30 minutes to meditate. And he says, well, then you need to meditate for an hour a day. So the whole thing is when you don't have the time to do these things, you actually need these things more than the person who does have the time. Because from what we've seen is that you lose so much time in the patient education process. Now, that doesn't mean you're going to stop seeing patients and just write this out. But if you put some time aside and slowly start to develop these campaigns, you can start with the stuff we provide for you, no doubt. You can speak to the community and get some made, but there are things that are specific to you. And we don't want to make a cookie cutter world of practitioners. You guys are all incredibly unique and talented and bring who you are to it. And so when you create some of this content yourself, that what we do is we will help you understand the most efficient ways to create this content. And it doesn't have to be a huge, crazy job. And we definitely provide a lot of it. But there's stuff that you're going to want to do yourself because it's going to serve not only as patient education, also as marketing, also as pre-education. It's ways that you're going to save time. When James talks about going from 7 patients to 12, the other thing about that is it doesn't necessarily mean that you just went from working 7 hours to 12 hours. The idea is you are creating more efficiency in a lot of the way you use your time so that you're actually getting paid and working and helping more people in less time. And one of the ways you do that is by focusing on how to automate some of this stuff. So yes, some of the education is done for you. Yes, you're going to want to do some of that education yourself. And yes, it will free you up to have more time. And as you have more time, you'll want, and what we see is our community ends up wanting to make the time to do more of this education. But you have to start where you are. Some doctors really only have an hour a week to put into working on their business. One of the big things that we talk about here is just the difference of working on your business and working in your business. And not every doctor works on their business or prioritizes it, and it's a very important part of the program, and also just part of being an entrepreneur and a doctor today.
Absolutely. Yeah, and that's a big part. We've got, when you sign up in the first module, we've got 10 emails that you can put into a 14-day warm-up campaign that are already written, and then you can just go through and edit them, and we've seen that people can do that in typically like a couple of hours, to go through, edit them into your voice, edit them for the specifics of your practice, and then follow the video of our Chief Operating Officer, Uli, putting them into either MailChimp or GetResponse. If you have your own CRM, you can do that. And that's the basis. Once you have that thing that turns interest into new patients consistently, then you can push more people into it for marketing. You can tweak, the subject lines and the links so that you increase the conversion of the traffic into new patients. And getting enough new patients is a starting point, but we also like to really focus on the efficiency, as Gabe said, because with provider teams, with groups, you're able to see a lot more people in less time and still offer the highest quality service. So we have, we have in the member area lots of stuff with experts from the field in how to do a perfect first appointment. What are you going to do in your first appointment to make sure that the majority of people get really excited about your program and start to be a participant in their care. We got stuff on how to do a great dinner talk to convert new patients at an event. We've just gone out to find who are the people doing this the best in the whole community and just ask them how to do it and share with our community. We got twice a month, we do these group coaching calls where it'll either be me and Gabe, or it'll be someone from our team, our copywriter, our community manager. And then we'll also bring in experts who have been doing this successfully for years. So any more questions coming in? Let's have a few more questions. Otherwise we can, we can wrap it up. Gabe and I are happy to stay here as long as we want. I would just say to everyone, look, sign up, come and start implementing the autoresponder. If you don't feel that this is something valuable, you got 30 days to let us know and we will refund you. Our goal, if you can run it by yourself, just reading my book, go and read the book. It's still 99 cents off Amazon, and implement it yourself. If you need the support of step-by-step guides and a supportive community of practitioners to do that, join the accelerator. And if you want to come to LA in January and hang out with us and to actually do this all in 3 days, under our supervision, with our copywriter, with our COO there, we have a few spots left in our sprint weekend, which is where you'll come and do it all in 3 days. So we try to offer something for everyone, no matter what type of entrepreneur you are, but it might help you to work out that you're not an entrepreneur, and that's fine too. The only thing is, up until this point in medicine, in history, the only way that you could do functional medicine was as an entrepreneur. But guess what? The Cleveland Clinic is happening. These micro practices are happening, and the majority of these micro practices are going to turn into big practices, and that's fine. You can be an employee of one of those practices. There will be jobs available to you, but what we're trying to do is smooth the path for as many practitioners as possible to build a successful practice on their own, being an entrepreneur, and this training is designed to do that. Any questions that we missed, Gabe?
I think we hit all of them.
I see one asking about the packages and what sort of packages you recommend. I would say, one of the things that you have to appreciate with functional medicine is that you're not going to reverse someone's diabetes in one visit. So you have to start to think about, how do you create a structure where you can actually spend time with patients and where you can actually empower them to be their best selves. So we've got examples of direct primary care practices, packages of, where you get your supplements and labs and visits and group education together. We've looked at what are the best systems that are going out there. We've spoken to thousands of practitioners over 3 years while building the community, and we just share the best practices as they happen. And there is innovation happening all the time in medicine, and we're finding what that is and sharing it with our community.
Yep. Absolutely. So,
any more questions here? It's
again,
6. So
again, the program, you could try it for 30 days. We created it so it's $500 if you do it in payments, and there's 7 payments. There is if you go to goevomed.com/accelerator, you can, so you meant our packages, right? So 3,000 versus 12,000. So $3,000 is the accelerator, and you can do that in payments of $497, or you could do it in $3,000, and you have access to it for life. You're in the Facebook community, and you're part of what we're doing. $12,000 is the implementation sprint. So one of the things we're offering, and there's about, I don't know how many are left, but we're going to work with about 16 to 20 doctors together, or practitioners in LA. And we're actually going to take you through and work you through the process of implementing all these things with professional copywriters there, with our COO, with James and I there in person. And we'll work with you for a weekend, getting you up and running. So for those people who want to have that experience with us and sort of guarantee where they're ending up. Now, the people who don't do the sprint, I mean, no one has done the sprint that's in the program and they're implementing it. However, coming and doing that sprint with us will be a lot of fun, and will ensure that you get to where you're looking to go in the time frame that you might need it done. So, James, maybe you can talk more about the sprint, because it's a good question.
Yeah, so sign up today. You have to spend $29.97 to, and then you can get on a phone call with Gabe, and Gabe will just see if it's a good fit for you. But basically, everything that you would learn in the accelerator, you'll be able to. First of all, between now, you get the accelerator. So between now and January 7th, you will have 2 months to start implementing things. When you get to the implementation sprint, we will spend 3 days with you honing your copy, honing your, doing all the things that you would do in the accelerator, and just having the guidance of our team to be able to do it, so that once you leave, you feel 100% set up. You've got your conversion engine set up, and when you're going to be doing these events, you know how to run your marketing events, you have your patient education system set up. All the things that we're working out there, you'll just have, us there to help you to do it. And you get to hang out with me and Gabe and the rest of our team. And, it should be a lot of fun.
Yeah, I mean, it's really, if you think that could be a fit for you, or it's something you're considering, basically you're going to pay the same amount for the course as you do the deposit on the sprint. You'll get the course, and then we'll have a phone call, and we can really talk in more detail about what this looks like and does it make sense for you or not. Again, our approach is, if it's a fit, we're happy for you guys to be a part of it. We're not looking to, pressure anyone to be in this course or to take it. We've learned a lot in these last years. We're very proud of what we've created here. We're very happy with the outcomes, and we're excited to be a part of it and to share it with people. So, you have an opportunity to expose yourself to it and to the content that's in it, and to start to make changes and change your practice, change your life, and change the lives of the other people that you're seeing, the patients. And that's what really
change and make it easy for every other practitioner in the community. The coolest thing about what we set up is that each additional practitioner that comes into the community and is a vibrant, supportive part of that community makes the community that much more valuable. And that's what Gabe and I are really proud of, and that's what we can build on. That's a scalable asset for the future of medicine. We're all about scalability. The one question that we started asking 3 years ago, which no one had asked, is like, what if we started acting like we're winning in functional medicine? And so if we're acting like we're winning, the kind of question that you really want to ask is, what if we needed 100,000 practices like this? What would we do? And that's guided all of our thinking for the last 3 years. And so we sought out technologies to be sponsors for the show that could help the delivery of care to 100,000 people, 100,000 practices. We've looked at the training programs that could get us there. We've looked at technologies that help run an efficient enough practice for it. And so that's where we are now, and that's the goal, is how do we set up the 100,000 micro practices. CrossFit wants one in every practice. Lifetime Fitness is building functional medicine practices in all of their gyms. This is the time, and we're here to guide you through it. So thanks so much for being with us. It's been great to spend the time here. If you have any questions, you can call the phone number on there, speak to someone from our team. But more than anything, we appreciate you taking time out of your evening to be part of our community, and we look forward to having you as part of our accelerator community.
Absolutely. And if there's more stuff you want to learn about the course, you can go to goevomed.com/accelerator. And if you feel like it's a fit and you want to just explore the course, you go to goevomed.com, join, And immediately, if you do sign up, go right into the Facebook group and, you know, say hi and get involved. That's been the funnest thing. The most fun has been watching that happen this week as the course has opened up. Okay. So